Doctors of Reddit, who's the dumbest patient you've ever had? Story 1. Young couple come in saying they have tried conceiving for almost a year, but she's still not pregnant. I start by taking her patient history. Turns out she's been on the pill for years due to period pain. Edit. Also, when I explained how the pill works and advised her to discontinue and keep trying for a baby, they didn't believe me and insisted on being referred to a fertility specialist. Story 2. Ophthalmologist here. Patient's eye wasn't getting better, so I asked if he's using his drops in the correct eye. He wasn't. He argued that his right eye is really his left eye because he throws a ball with his left hand. I argued right versus left with him for a good 5 minutes before I gave up. He won the argument. I've had 2 patients who stare at the sun. They both said it's like stargazing because the sun is technically a star. I had a blind patient who was still riding a motorcycle. He rode into a house and had to give up his motorcycle. Story 3. I thought this only happened in TV shows, but one of my sister's friends is a doctor and told us about a teenage girl that came to the ER with abdominal pain. Yes, this is going where you think it's going. When asked, she swore up and down that she couldn't possibly be pregnant. They ran the usual tests and, wouldn't you know it, the girl was pregnant. She could not believe it. Total denial. But she did not deny having with her boyfriend, so the doctor, my sister's friend, asked her what birth control they used. Apples. She ate an apple after having with him. Story 4. My mom worked at a major hospital and heard the story of a guy who called the emergency line saying that he'd accidentally stabbed himself in the torso with a knife while cutting something. Their first piece of advice was to not remove the knife. To which he replied, "What do I do if I did remove it?" And they gave him instructions. When the ambulance arrived, they found the man with the knife in his torso. Yep, he put it back in. Story 5. Worked at an urgent care for some time, late teens. Patient F comes in with mother for abdominal pain. I have a student doing the initial history and exam. Swears there is no chance of pregnancy, but is sexual active with SO, but swears no penetrative. Well, we get the urine results back. She's pregnant. Student goes back in, asks the mother to step out, and has to have the most awkward conversation with this patient detailing what was. Well, it turns out she was indeed not having penetrative with a penis. The happy couple would fool around and then use the males as lube for her to get fingered. They thought that to get pregnant, the penis had to fall off and become the new baby. Edit. I'd like to add that, depending on your definition, this girl was a pregnant virgin. Story 6. This doesn't exactly fit the criteria, but it's close. Not a doctor. I'm a nurse. And not a patient, family member. Back when I still worked in the ICU, I had a family come in during visitation to see their loved one carrying one of those plastic containers from a grocery store bakery with half a dozen cupcakes inside. Not unusual. Families would bring us food all the time and it was incredibly nice and we always appreciated it. Nope. I walked into the room to update them on the patient and we talked about it also being her birthday that day. They gestured toward the cupcakes and said that's why they had the cupcakes with them. I thought that was really sweet. They were going to celebrate her birthday with her even though she was in the ICU. Then they hand me the container and look at me expectantly. I look back, unsure of what my next move was supposed to be. Aren't you going to feed them to her? This woman was on a ventilator and on IV sedation. It took me an embarrassingly long time to explain to these people why she couldn't eat while she was unconscious with a breathing tube in. Nice folks, not terribly bright. Story 7. In training, had a surgical patient getting toes amputated because of diabetes. All shift he kept getting insulin, but his sugars wouldn't come down. Just didn't make sense. Eventually found a lot of candy under his pillow. Not sure if it's dumb or just sad. Maybe a bit of both. Story 8. I discharged a Russian patient after he had been hospitalized for alcohol-induced liver damage. As I was getting him out the door, I impressed upon him the importance of avoiding alcohol, and he asked me sincerely if vodka was considered alcohol. Story 9. Not a doctor, but I had a lady come in complaining that she couldn't afford her medications anymore because she was smoking half an ounce of weed a day. Not a gram, but literally spending 200 a day on weed. I also had a 20-year-old guy who came in because he was feeling sick, but neglected to tell us that his penis was rotting off and necrotic. We didn't know until his wife came and asked us about it a few days later. Story 10. The other day, an established patient came in for an emergency dental visit because all of his teeth were hurting worse and worse and worse, to the point where he could barely touch them with a toothbrush. The pain started a few weeks after he had started swishing with peroxide every day. He had decided he wanted less bacteria in his mouth, and he decided that swishing with peroxide would be the best way to do this. But now, every time he used the peroxide, his teeth became severely sensitive and painful to touch. Me, wondering how to gently break the news to this otherwise bright guy that he was being dumb. So, have you tried not swishing with peroxide? Him. Well, no. Me. Well, try that. What do you know? Problem solved. This is certainly not my dumbest patient encounter, but it was recent and the only one that comes to mind at the moment. Edit after many DMs and comments. What made this patient dumb was not the fact that he swished with hydrogen peroxide. Many people do this. and it really doesn't hurt or help them. Maybe it makes them feel good. In this guy's case, it caused him a ton of pain, but he didn't realize he could just stop doing the thing that nobody told him to. To me, that's a dumb moment. Story 11. Not a doctor, but was an administrator at an ophthalmology clinic. 1. A patient had to be prescribed some pills before his eye surgery. He returns 5 minutes after his consultation super concerned, as he didn't know how he was going to get the pills into his eyes. Our nurse suggested that he try swallowing them. 2. Another patient had chronic dry eyes that he was seeing one of our doctors for, and one day called for an emergency appointment as his eyes were in pain. Apparently, he had heard of honey being used in eye drops to help with dry eyes, so the man put straight honey onto his eyes. Story 12. Not a doctor, but cath lab tech. Had a patient's wife sneak him a sandwich before his heart cath, not supposed to eat before since we used some sedation. And they didn't tell any of us despite many times confirming he did not have any food or drink. The patient then threw up and aspirated during the procedure. Ended the rest of his week in the ICU and almost died because his wife snuck him food. Please listen to your healthcare provider's instructions before procedures. These rules aren't in place to torture you, but to keep you safe. Story 13. I'm a PhD clinical psychologist, so not a physician. Patient came in for an emergency appointment. Usually these are folks who are suicidal, recently assaulted, manic, or in psychosis. He filled out all our paperwork, so many questions about mental health history, and sat in our waiting room. I can't tell you how clearly this is a psychological services clinic. Finally, he gets back to my room, sits down, and pulls up his pant leg, starts taking off his shoe. My man had ankle pain. Me. I'm really sorry you have been waiting for so long, but unless you want to talk about how your ankle pain is making you feel, there isn't anything I can do. It took a little convincing that I wasn't holding out on him. No, I wouldn't just take a quick look at it. He was baffled and kept saying, "But you're a doctor." I'm not convinced I successfully explained the difference between a psychologist and a physician. I don't even think he was drug-seeking. He was freshly 18 and not the brightest bulb. He eventually limped off to the nearest urgent care. Poor kid. Hope he's okay out there. Story 14. I have a few good ones. 1. My sister's a doctor, and she saw a patient and prescribed meds. Asked them to come see her a week later as a follow-up. Patient comes back next week saying that they don't feel better at all. Sister asks to see the meds she prescribed to ensure they got the right ones. Patient says they never picked up the meds because they only wanted meds with organic ingredients, not one full of chemicals. 2. Husband comes in with a set of complaints. Sister proceeded to check him out and find that there was nothing wrong with him. That's when he told her that it's actually his wife who had those symptoms, and he never brought her in to get checked. On top of it, he was pissed that the doctor couldn't just fix his wife without seeing her. Story 15. Not a doctor but work in medicine. Shout out to the patient who in one visit told us that insulin didn't work for her personally and that her diabetes worked different than other people's. Also in the same visit, she tortured the poor medical student. She told the medical student that it was her 7-year anniversary. The medical student congratulated her. And then she goes, "It's the 7-year anniversary of the day he left me." Medical student was mortified, and I was super annoyed. Lady, why? How was the poor medical student supposed to know? Story 16. When I worked as a medical assistant in an OB/GYN clinic, a patient called to make an appointment because she needed a fallopian tube. I was so confused I asked her if she was meant that she wanted to get her tubes tied. No, she said, "I'm trying to get pregnant, so I need to get a fallopian tube." Definitely booked a visit for pregnancy planning education session. Story 17. I am not a doctor, but I do work in pediatrics. I would say 90% of the time it's the parents who are dumb, not the kids. But anyway, I am sitting in the dictation area and a coworker is dictating her note, and I hear, "Patient comes in today after submerging his cast in the ocean and proceeding to roll around in sand." At this point, I let out a giggle, and she goes, "Oh, it get worse. He has pins in." The kid is 5, and the parent goes, "I trusted him not to go in the ocean," which I have so many concerns and questions with that statement alone. You don't trust a 5-year-old, and, were you not watching him? The kid comes in, gets his cast off, literally saturated, and there is sand everywhere, and gets started on antibiotics since he has exposed pins. A few days pass, and the kid does it again. WTF parents, do your job. This one is just a fun story, not dumb. 4-year-old in a long arm cast, above the elbow, was playing with a beetle, and it went inside his cast. When he came in, he said it stopped moving at the elbow, and sure enough, when we took the cast off, there was his beetle friend. He was very sad it was dead. Story 18. Retired GP here. I had a male patient aged mid-50s who presented with trouble urinating, decreased flow of urine, and occasional blood in their urine. I immediately referred the patient to clinical triage with a recommendation for an initial MRI to look for prostate cancer. The patient returned to see me 3 months later. Symptoms had worsened and included bone discomfort and pain. Turns out they had refused any MRI and blood tests and had gone instead to a homeopath for 3 months. Utterly useless. Unfortunately, in those 3 months, The prostate cancer he had had spread to his bones. He died within 6 months. Story 19. I'm definitely not a doctor, but there was a period of about a month when my grandparents were having some concerning health symptoms. My grandpa wasn't as bad, just lethargic, but my grandma was seen with a far-off look and drooling into her lap when she was a perfectly capable woman. My family somehow found out that they both had med prescription changes after a recent doctor visit and concluded that what was happening was likely their drugs interacting. They were asked if the doctor told them to get off the old meds before starting the new ones. My grandpa said, "Yes, but we didn't want what was left to go to waste." My parents were in charge of periodically checking their meds after that. To be fair, my grandparents grew up during the Depression era, which could explain their reasoning. Story 20. Oh wait, one more. It's like 10 p.m. and wife is on call. Suddenly her phone almost literally blows up. 3 calls back to back from the hospital, her messaging app going off, and 3 more calls from an unknown number. She calls back the hospital and is told it's a severe emergency, and woman is about to get on a plane but is having a panic attack and needs Xanax. My wife explains that she cannot provide that over the phone, especially just being on call. Well, the nurse, I want to say dispatcher, tells my wife I gave the patient your cell phone number. Wife flips understandably, gets like 15 more calls before she answers. So my wife asks her who her doctor is at the hospital and she will try to get a hold of them. The patient's response, "I'm in this state not too close to yours. I've never been to your hospital, but I need Xanax now." Story 21. Not a doctor, but an embryologist. Had a man come in to do a semen analysis before starting IVF with his wife. Put him in the collection room with instructions like normal. He rang, and when I went to go grab his sample, I see that he straight up pooped in the cup. Turns out the couple had absolutely no idea on how to make a baby, and that's why they were having fertility issues. Unfortunately, not my only story like this, just the worst one. Story 22. Not a doc, but a PA. In school, had a guy come in with his very pregnant wife asking for a vasectomy. Okay, cool, let's chat. First question he fires at me. Can I keep them once you finish the surgery? Dude thought he was getting his literally chopped off. After explaining the procedure to him and how the doc can do it in an office, he was so relieved. Got a good laugh afterwards thinking about it. Story 23. Was a med student at the time. IV drug user, couldn't find any more veins. Looked down and saw the dorsal vein of the penis. Tried to inject there, missed and got it into the shaft. It got very infected and swollen, developed cellulitis. He tried to drain what he thought was an abscess. It wasn't, it was just cellulitis himself, with a steak knife. Now it was extensive penile cellulitis with 2 stab wounds in it. Angriest looking penis I've ever seen. Story 24. Had a patient that super glued a crown back on 10. He wasn't a usual patient, but his dentist wasn't open that day. He didn't get even close to down all of the way. So this crown was keeping him from closing. He got mad at me when I told him not to use super glue. He said, "Okay, smart guy. What should I use to put a crown back on?" He was giving me the smuggest I can't close all the way smile he could. In one of the rare times I got a retort out with good timing, I replied, "A dentist." My assistant ran out of the room and I could hear her completely lose it laughing down the hallway. The patient wanted me to fix it, which was cut off the crown and make a new one. I asked him what his medical history was. He already signed one he filled out, but I always ask because people leave stuff off, and specifically asked about heart procedures. He said he just got out of the hospital 2 days before, from having 4 stents placed after a major heart attack. When I asked him why he didn't put that on his medical history form, he said, "You're a dentist. You don't need to know that." Told him I need a medical release for treatment from his cardiologist, and I would not do anything until I had one. He seemed not to understand that his mouth is attached to the rest of his body. He was pretty mad I wouldn't do what he wanted, but I didn't want to call for an ambulance that day. Story 25. In medical school, had a patient come in for abdominal pain. During my series of questions, I asked if the patient could be pregnant. She said no, because she is a lesbian. The attending had us order a pregnancy test in addition to blood work anyways. Pregnancy test comes back positive. This time I asked the patient if she has had with a man. She responded yes, but was confused as to how she could be pregnant if she's a lesbian. My attending replied, "Honey, they don't care if you're a lesbian." It blew my mind that she didn't think she could get pregnant simply because she identified as being a lesbian. Story 26. During my intern year, a male patient in his mid-20s gets admitted to the surgical floor for third-degree burns in his right hand. I go to check on him and do the normal interrogation. When I asked him how he burned his hand, he proceeds to tell me that it was a minor burn. At first, just a little redness on his fingers and palm, because he touched something hot, and his friends told him that in order to heal it faster, he should boil an ointment that has cannabis with peyote, and then to put his hand in it, which is how he ended up with third-degree burns. Some people lack common sense. Story 27. So my wife's a doctor, and these are 2 diabetes-related stories. 1. Big guy. I split my mom's diabetes medicine with her, but I check my sugar regularly, and it's between 400–450. 2. Woman complaining that the lancets don't work. She has a calloused finger that a harpoon couldn't puncture. My wife suggested using a different finger, and patient looked at her like she was Jesus himself and thanked her. Story 28. So veterinarian, but I have a few good ones where humans wanted me to treat them. My first week in clinical practice, I had a client that called in telling us she had taken her cat's flea medication, Credelio, and wanted to know what to do. She became quite hostile when we instructed her to contact human poison control and a human doctor, and insisted that because it was a veterinary drug, it needed to be treated by a veterinarian. I had another client who was convinced he had gotten worms from a puppy and decided that we needed to test his stool as well. We told him he needed to speak to his own human doctor. He got angry and informed us that he doesn't go to the doctor and defecated in the middle of our lobby. I had a client call the board of pharmacy on us because we filled her pet's medication, flea, tick, tock, heartworm prevention, but informed her that we couldn't fill her personal medication because, as a veterinary hospital, we're only allowed to fill pet meds. We also offered to script out the pet meds to an external pharmacy that could handle both if she wanted to get both from the same place. The person that contacted us from the state board was just as confused as we were. I had a client bring in his own hip x-rays for us to evaluate and tried to pretend they were for his dog. He was genuinely surprised that we could tell right away they weren't from the dog. Although as far as stupid goes, I had a client who bought an Aussie Doodle from an Amish breeder and was so enthralled with him that they went back a month later looking for a mate to breed him with, and was lucky enough to find a female from the same parents with the same birthday and everything, and so it must be destiny. It took us a really disappointingly long time to explain that these dogs are siblings and should not be bred. They were convinced that they couldn't be siblings because he was mounting her. They'd ironically named the dogs Luke and Leia. Story 29. I'm not a doctor, but I work in a hospital emergency department. We had a young woman who closed a car door on her hand and severed 2 fingers. She brought them along in a Ziploc bag. Obviously, the car door didn't make a nice clean cut, so the fingers were not able to be reattached. She was furious, yelling and smearing blood everywhere. She left AMA without letting the doc stitch her hand. A little while later, the computer showed she had checked in at the emergency department at our sister hospital. Someone wondered aloud whether she'd be able to talk them into trying to reattach the fingers, and I said nope and held up the Ziploc bag she'd left behind. Story 30. Obligatory NAD was an ED tech. We had a patient come in with a raging case of gonorrhea, sent him home with curative treatment, and education on when he can safely have again, etc. DC'd. I was working the desk that night, and he calls up there screaming in pain. He wanted to have with his girl because he just couldn't resist, so he decided to pour a bottle of Everclear on his penis and anus prior to intercourse to kill the germs. Ended up dispatching an ambulance to him. He chemically burned through his urethra and ended up having a urethroplasty. Story 31. I'll add one more, and this isn't exactly medical related, but still dumb. The hospital my wife worked for asked her if she could see Tony at 5 hour for a quick follow-up, 10 minutes. Now, other doctors there were it's 5, I'm not staying into 5:01 unless I'm on call, but she said sure. She figured it was an issue with medicine and just changed the dose. Patient walks in with an entire Social Security disability packet that he needs today. My wife could have been exaggerating, but she said at least 50 pages, plus copies of his notes and records. Then proceeds to tell her, this might take longer than 10 minutes. I had to lie to get the appointment, but I can wait. Story 32. My friend told me this story. She was sitting in on consults for training. This woman in her 50s came in, new patient. She reported a few symptoms, but whenever the doctor suggested a test or treatment, she refused. She then wanted a letter saying she wasn't crazy. She denied the option to see the on-site psychologist. She wouldn't leave without a letter or copy of her notes to prove she wasn't crazy for her divorce or something. So the doctor gave her a printout of the consult notes which said she refused all treatment. She left happy. Story 33. My patients are all cats and dogs, and most of them are pretty smart, but their owners? My dog doesn't need heartworm protection. We live in a gated community. So, the mosquitoes respect the gates, huh? After my cat is spayed, can she still have kittens? Well, spaying is removing the entire uterus and both ovaries, so no. I was on the internet doing research for 2 hours, so now I know more about seizures that you do. Yes, I'm sure 2 hours on YouTube is far better than 4 years of vet school, a 1-year internship, and 15 years of practice. Okay, my dog isn't getting any better. Did you give him the medicine I prescribed? No, he didn't want to take any pills. The anti-itch medicine you gave me was great for a while, but then it stopped working. I sent him home with a 1-month supply. It is now 3 months later. Clients say so many stupid things I have stopped keeping track. Story 34. Not dumb, but with very odd priorities in my eyes. Crippling pain in her feet, toes deformed and bruised, and all she wanted was injections against the pain. Her shoes were way too small, but larger ones are ugly. Utterly refused to get fitting shoes. Sorry, it's not my job to help someone hurt themselves. At least Cinderella's stepsisters had a prince and kingdom to win. Maybe I'm just not into fashion enough. Different workplace, dumb colleague. I asked the patient why they came to inpatient rehab. My GP said I needed a vacation. We're a trauma center, not an all-inclusive wellness resort. I don't think group therapy with severely traumatized people will be all that relaxing. And no, we don't offer daily massages and cocktails. That happened more than once. Colleagues, please don't try to bind up scarce resources, even if you like the patient and they really do need a vacation. Story 35. I have a family member who is an optometrist and says he has had multiple patients come in with permanent damage to their eyes because they stared at the sun for too long. It is apparently very hard to break it to them that the eye doesn't heal itself in that way. Story 36. Eye doctor here. I have two groups of dumbest patients I see regularly. People who abuse their contact lenses and end up giving themselves corneal infections and other issues, and people who don't wear safety glasses when they should be. It's not hard to take your contacts out before bed and clean them properly, or throw away if they're a daily disposable. It's not that expensive to change your contacts as directed, and it's a lot cheaper to not have to visit my office multiple times for medical visits where I'm trying to save your eye vision from your laziness, idiocy. I had a patient just this last week with 20 scars between his corneas from previous infections. A new record for me. I also take metal and other foreign objects out of people's eyes almost daily, and 99% of the time, the patient wasn't wearing safety glasses. I've had an instance where a patient had a piece of metal wire from a wire brush penetrate his eyeball, and he decided the best thing to do was pull the metal out and wait 3 days before getting it checked out. He had a case of endophthalmitis, a severe infection inside the eye that, if not treated aggressively and quickly, will make you lose your eye entirely. He needed emergency surgery and was lucky enough to have the eye saved. Another patient wasn't wearing his safety glasses and a piece of metal hit his eye. At high enough velocity, it penetrated into his vitreous and was floating there when I looked in the back of his eye. He also needed emergency surgery. Please take care of your eyes, people. Visit your eye doctor regularly for examinations just like you do the dentist. We can only replace certain parts of the eye, and losing vision in one or both eyes can be extremely difficult to get used to physically and mentally. Story 37. I have a family member who's a doctor who once walked into the exam room to find a young kid standing on their desk, feet on the keyboard trying to reach into the sharps container mounted high up on the wall. The mother was just sitting there letting it happen. Story 38. Dementia patients do all kinds of dumb, like eating styrofoam. It was fine in the end. And cork. That one didn't end well. But my favorite two stories. 1. Young girl comes into urgent care on Christmas Day. Swollen face? Obviously allergic. States she's allergic to peanuts but swears up and down she didn't eat them. Family is there with her. Confirms she didn't. We're trying to find out what happened in the next room over when I overhear her say that she liked the homemade satay sauce, which has peanuts as the main ingredient. Mind you, homemade, by herself. Yeah, that one was dumb. Second was one of my long-term care patients whose sugars were consistently too high to measure, but she only drank water and ate only apples. Never mind that you could see the piles of candy bars on her nightstand. Favorite moment there was her going to the supermarket for fried snacks, trying to use the microwave for it, and failing, setting the thing on fire as a result. Firefighters came, and the patient proceeds to stuff the blackened remains of her snack into her face, in the presence of the first responders and my team. Unfortunately, I wasn't there to see it myself, but that was a wild note to read the next day. To this day, I wonder how that patient got past 50 and didn't die. Story 39. Family member is a physician. He once told me about a patient who was being prepped for a procedure. As he was covering known allergies, again, the patient suddenly remembered an allergy to latex gloves. The procedure was delayed as the room, materials had to be reviewed for any latex, gloves were replaced, etc. In recovery, my cousin asked the patient why the allergy had never been previously reported or documented. It turned out that 1. The patient didn't actually know the definition of an allergy. 2. They simply did not like the sound and feel of latex on her skin. She would have neither heard the snap of the latex gloves or felt them against her skin due to the fact that she was going to be out the whole time. Story 40. 22-year-old burn patient life flighted in overnight. I got there in the morning and she was the talk of the burn unit. This girl was out at the bar with a group of friends the prior night and managed to run up a $200 bar tab that she couldn't afford to pay. So her friends tell her they'll pay for her tab if she lets them pour Bacardi 151 on her and light her on fire, and she agrees to it because she didn't know alcohol was flammable. Story 41. Urologist had a patient come in complaining that based on her internet reading, she had a vesico-vaginal fistula. No history of trauma, surgery, malignancy, or infections. It's just that after when she stood up, some goo would drip out. Story 42. When I was a student, I had a young guy come into the ER with psych complaints. He was worried about his thoughts. He said that he has these out-of-body experiences. He feels like he can't control his mind or body. and he just feels odd. I discuss with my attending and we're about to consult psychiatry. We go and interview the patient together and discuss things further. It turns out that he gets these symptoms about 3 times per day. Subsequently happens after he smokes weed, so he was just getting high. Story 43. I smoke meth for my blood pressure. I don't take my blood sugars because the numbers are too high and I don't like them. I can't pee until I give a urine sample. I think I can't pee because I have thyroids. PT on coke. Favorite interaction, Doctor 2 PT. Did you actually stab someone? PT, yes. Doctor, are they okay? PT, yeah, it was just a little one. Don't sow drugs, kids. Or if you do, just don't do meth. Story 44. My sister is a nurse practitioner and does wound care. She takes care of a lot of old Hispanic women who have diabetes. Apparently, they put Vicks vapor rub on their wounds like that's going to do anything. One lady took her sock off, and her black toe literally fell off. She asked my sister if they could reattach it. My sister told her there are no blood vessels left, so no. Story 45. Firstly, I'm a nurse. This one's a bit of a 2-for-1. We had a guy present to emergency with a stab wound to his palm. He had been trying to remove an avocado seed by stabbing the seed with the pointy end of the knife whilst holding the avocado. The knife slipped and went through the avocado and into his hand. The doctor that reviewed the patient went home that night, and while preparing dinner proceeded to demonstrate to his wife how this dumb patient tried to remove the avocado seed by stabbing it. Knife slipped, and he stabbed his hand. Literally never lived it down. Story 46. I'm an ER doctor, and I'm pretty late to this thread, ironically because I was working, but the number of stories I have of dumb patients is countless at this point. Some are dumb, and some are just very unintelligent or very uneducated. You guys have to realize that just by being on this thread and being able to write in full sentences, you are more intelligent than a large number of people who may have at most a 200-300 word vocabulary. These people get sick like anybody else. And one of the hardest parts of my job is trying to ask them questions about their symptoms while using very basic words and then interpreting their extremely disorganized and sometimes wrong answers to find a diagnosis as best I can. For instance, I've made it a habit of pointing to the areas I'm asking about because some people don't know what a chest is. I've had so many patients tell me they have no medical problems, but then their medication list is pages long and they tell me that those medicines cure them of their diabetes, high blood pressure, etc., so they don't have it. I once had a guy scream at me that I needed to give him morphine because he has a constitutional right to not be in pain. I've had a 36-ish week pregnant woman who used meth the entire pregnancy hit me in the head with a thrown object because her free turkey sandwich didn't come with the mayo already on the sandwich. I've had a guy stabbed straight in the neck come walking in saying he got stabbed, then being shocked when I told him I had to act fast or he could die and to please get off his phone with his homies. I could die? How? My brother. You were stabbed in the neck and you're covered in blood. Oh, and so many people who use meth, fentanyl, any number of street drugs, but I ask if they're vaccinated against COVID as part of their screening process, and they go, EW no. I don't know what's in that vaccine, I'm not putting it in my body. Story 47. I do a lot of pregnancy tests in my job. A woman came in to initiate birth control. Husband was there too. Did a pregnancy test, and it was positive. When I revealed the results, husband goes, "That is impossible. I have been deployed for 12 months. Wife agreed that it was impossible. I told them that the test was accurate and that she was, in fact, pregnant. Husband said, "You must know, since we are married, it is physically impossible for my wife to get pregnant by anyone else." "No, sir, that isn't how it works." Him. "Well then, who do you propose the dad is?" In a very sarcastic tone. Me. Jody. Story 48. Not a medical doctor, but a doctor of physical therapy. It's less wild than most cases here, but like 95% of my patients think they can stand or move for fewer than 15 minutes a day for 20 years and not have back and knee pain, and then think that I can make them be ready to climb the stairs in Positano with their grandchildren in 4 weeks. Story 49. Veterinarian. Bulldog eats the electronic car keys. Owners just decides to drive with the dog everywhere to unlock, Nosh, start the car. She only comes in after 48 HRs when the key stops working and the dog is vomiting. Story 50, tech for ophthalmologist here. So many stories. Patient got a referral back to see us as they hadn't been seen in 3 years. Saw optometrist because his eyes weren't right for more than 6 months. Retinal detachment. No treatment can be done because he waited over 6 months after the fact to get his eyes checked. Story 51. Not a doc, but had a patient who would get the runs anytime he consumed dairy, but swore he wasn't lactose intolerant, would request milks, cheese, etc. at lunch. And you'll never believe what happened after.